The COVID-19 pandemic has highlighted the linkages between the health of humans, animals, and the planet. So, how can the global health community take on these interconnected challenges? We'll hear from leaders in planetary health and One Health about opportunities for collaboration. First, I'd love to welcome Sam Myers, Principal Research Scientist at the Harvard School of Public Health. He also directs the Planetary Health Alliance, which is a consortium of organizations around the world committed to understanding and addressing the health impacts of environmental change. Sam?
So to me, the arc of the planetary health narrative is that there's just been this explosion in, as a result of sort of scientific and technological developments, this explosion in the size of humanity's total ecological footprint. And people have called this the great acceleration. But if you go back and you look at sort of curves of human consumption over time globally, you see these really kind of astonishing kind of exponential curves that started in around 1950 and just were, have accelerated since. And whether you're talking about proliferation of motor vehicles or appropriation of fresh water or exploitation of fisheries or production of paper or plastics or energy use, they all have that same shape. And if you look at impacts on natural systems, they also all have that same shape, where we've had these really outsized impacts in terms of biodiversity loss, chopping down forests, adding carbon to the atmosphere, these big scale impacts. And they all look really similar because of this sort of fundamental underlying trend, which is that the human population's been growing really fast and per capita GDP has been growing even faster. So when you multiply those to get total world GDP, it's essentially a vertical line over the last few decades. So it's hard to overstate, right, the scale that our ecological footprint is now taking on the earth. And I don't think that many people in your audience will really grasp that scale. So, 40% of the terrestrial land surface is being used for croplands and pasture. We're appropriating half the accessible fresh water on the planet, mostly for irrigating our crops. We've dammed 62% of the world's rivers. We've cut down half of the tropical and temperate forests. If you look at biomass of mammals on the planet, 36% of total biomass of all mammals on the planet is us. 60% is our livestock. 4% of the mammals on the planet are actually wild mammals. We're driving species extinct at 1,000 times the baseline rate. There are about a million species facing extinction, many in the next decade. So it's hard to overstate the way that we're sort of crowding out life on the planet and transforming these systems. And it's the urgency of that moment, of those exponential curves that we're sitting on top of, that explains the emergence of the field of planetary health right now. And it's the recognition that not only is our house sort of on fire, right, that our natural systems are really kind of crumbling under the weight of our ecological footprint, but we're in the house, right? And there aren't any exits, right? We don't have another planet to go to. So it's this recognition that this isn't just a matter of an ecological crisis. You don't have to be a tree hugger. You don't have to be worried about the polar bears to be concerned, because it's actually what we're learning from planetary health science and research is that there are enormous impacts on our own health and well-being in every dimension of health. And there's we just published this book. There's a rich sort of body of evidence across each one of those dimensions. So the narrative is huge sort of ballooning in the footprint, rapid changes in natural systems, recognition that those changes actually represent clear and urgent threats to human health. And then the sort of, okay, that's the diagnosis. What's the treatment? And the treatment, is what the World Economic Forum is calling the Great Reset, what we've been calling the Great Transition, what indigenous communities have been calling the Great Turning, what, Europe and President Biden are calling Build Back Better, but it's all the same thing, which is we've got to change the trajectory that we're on. We need to live differently. And that means across every sort of dimension of activity. And so that's where thinking about, food systems, and within food systems, it's, eliminating food waste, it's changing diets towards vegetable source foods, and it's changing production patterns to be much more efficient. And then there are energy systems and the need to move to a post-combustion energy economy. And there's the built environment and the capacity and really enormous promise of building cities to optimize for physical and mental health, but to minimize our ecological footprints. And there's a huge amount that can be done there. In manufacturing, how do we adopt circular economy and just be much less wasteful with the materials that we're using? How do we think about economic theory and accounting so that we're not slaves to GDP, but are actually measuring the things that matter to us as a society? And then there's sort of this cultural, spiritual dimension to this, which is that there's something fundamentally broken in our relationship with nature. So how did it ever get to be okay to treat our oceans and our atmosphere as gigantic garbage dumps? How did it become okay to extinguish other life forms sort of with equanimity and not worry about it? And so there's a need to sort of rethink our relationship to nature and to each other as part of this great transition that we're talking about. And so that arc, and to me, the hopefulness of this story, the sense that there's no reason to believe we can't get this right? So that in 100 years, we can't be living in a world where, population is just stabilized as part of the demographic transition, and educating girls, and economic opportunities for women, and access to contraception for couples who want it, and where we've already moved to a post-combustion energy economy, and the climate is getting stabilized, and where we're being much more efficient in our production of manufactured goods and food, and where with every passing decade, there's actually more room for the rest of the biosphere. And so that's a place we know how to get to. There's an incredibly rich sort of terrain of solutions, and it's a matter of having the will to get there. And so to me, the partnership part of this is the great transition. If you actually want to achieve fundamental, deep structural changes in how we live on Earth, that requires global scale partnerships across citizenry, sort of an activated global citizenry, the private sector, the policy domain at the very least. And those are the partnerships we're exploring now. So when we talk to, Imagine, that's Paul Pullman and Jeff Seabright's outfit, or we talk to CEOs from some of these really visionary businesses like Beyond Meat or Live Kindly that are sort of planetary health related businesses, or we're part of this planetary emergency partnership that's thinking about the sustainable development goals and interacting with these huge consortia of other businesses. It's all part of this conversation. And what we're really saying is that we need to frame the 2021 super year as a planetary health year, that it's within that lens, that planetary health lens, that all of these meetings on biodiversity and climate change and oceans and the UN food system meetings, that they all come into focus as actually part of a single cohesive whole where we're moving towards this great transition. And so that, I think that whole sort of arc and that narrative is important.
So Sam talked about the way that humans are crowding out life on the planet, and that's bringing humans and animals in contact with one another in unprecedented ways, creating more opportunities for zoonotic disease, infectious diseases transmitted from animals to humans. Dr. Tedros, Director General of the World Health Organization, has said, we can only prevent future pandemics with an integrated One Health approach to public health, animal health, and the environment we share. Now is the time to take our partnership to a new level. So to discuss what that looks like, I'm thrilled to be joined by Jonna Mazet, Executive Director of the University of California, Davis One Health Institute, to expand on opportunities for collaboration to advance One Health. Jonna, thanks so much for joining us.
Well, thanks for having me. It's a thrill to be here.
So I'd love to begin with this question. I've been familiar with your work on One Health for years now, but I don't think it's ever been in the spotlight in the way it is now. So how has COVID-19 really highlighted the importance of a One Health approach? And can you tell us more about what that approach looks like?
I'm feeling really charged about the world noticing the One Health approach, because I truly believe it is how we get ourselves out of ever being in this kind of situation again. The One Health approach has two central tenets from my perspective. One is that we look at this connection that you so nicely articulated among people, animals, plants, and the environment. And plants are kind of a new ad because our food systems are critical. And if we don't watch for that as well, we're going to really put ourselves at risk. The other central tenet that sometimes doesn't get discussed enough is that it's a collaborative process that brings in all of the disciplines or the areas of expertise that we need to address a problem. And I think that's where we have, as a society, all the way back to the beginning of time, we've had pandemics, unfortunately, and we have always had this sort of human-centric, arrogant approach that my discipline, what I work on, can fix this problem. I will go work hard, maybe even with my team, to try and find the answer. And what we need is the respect to cross platforms, just like Devex and the Prescription for Progress is trying to do. And we listen to each other, respect each other, and bring our areas of expertise to bear in a collaborative process.
So I want to ask you about PREDICT. And for those who are less familiar, PREDICT was an early warning project under USAID's Emerging Threats Division. And for 10 years, you served as its global director. Can you talk us through the importance of PREDICT, why it came to a close, and what's next?
Yeah, so PREDICT was really innovative approach coming from the U.S. Agency for International Development to really try to identify viruses before they make us sick. And now we know how important that was. Of course, we weren't working everywhere in the world, and we weren't working where SARS coronavirus 2 apparently spilled over and started the pandemic. But what we did do was we brought together teams, multidisciplinary teams in more than 35 countries to really use this One Health approach to identify not only viruses that were making people sick, but also viruses that were in animals that could spill over, and the behaviors that people were doing that would put them at risk. So in PREDICT, we were able to train almost 7,000 people and infect them with the One Health approach. We got 60 laboratories actually working to identify and discover viruses, and we were collecting all that risk data around the world for how people put themselves at risk from these viruses. So I'm really thrilled that those folks were actually the front line in the COVID-19 pandemic and helped their countries identify the very first cases that entered into their countries. And in those countries, their public health systems listened, reacted, jumped right in, and really helped to shut down the terrible effects that we saw in some other countries where we didn't act so quickly.
So I'd love to bring in a couple members of our audience with questions for you. First, let's hear from one of your colleagues who worked closely with you on the PREDICT project in Nepal.
My question to Jonna would be: the PREDICT project, a specific project, is over, but moving forward, how do you see the relationship that was built and fostered over the years? How do you see us continuing that? And one big question that PREDICT was able to kind of answer was that there is a larger, bigger need, more so now than any time before, of having a global collaborative project like PREDICT. And US has been, has shown a lot of leadership in the past. There was a lag in between, but things might be changing in the near future. How do you foresee that being continued in coming days, coming months, and years?
Well, it's great to hear from my friend Bess, and I'm really thrilled that part of the One Health approach is we build these relationships and we stay together as colleagues, friends, and like-minded researchers in this case, to try and solve global health problems. And so we'll be connected forever, but it is a question as how do we do the work? And I think the momentum coming out of this terrible pandemic will mean that we have the ability to work together. There are so many programs now growing in many different sectors. Just in the US, we have many agencies, the CDC, the NIH, USAID, continuing their efforts. But really for an equitable change in global health, we need all of the countries to have their own strong scientists like my friend, and to be working in this environment with a full seat at the table. And that's why I'm thrilled to be participating in the Global Virum Project as we move forward together and have a global coalition of folks that are ready, able, and have all the skills necessary to detect viruses, all the viruses, frankly, before they make us sick, and understand our behaviors that put us at risk.
Thanks, Jonna. So you also are co-director of USAID's One Health Workforce Next Generation program, which is an $85 million project to support professionals in Africa and Southeast Asia to address complex and emerging health threats. And I'd love now to go to Pat Kurachitam, who leads the Southeast Asia One Health University Network, with a question.
So my question to Jonna would be that, through the investment that USAID imposed on the universities over the last decade, and in terms of the One Health Workforce Next Generation up until 2024, I know that we all are struggling with the sustainable financial investment. So what would be your recommendation to the network, like us, like Southeast Asia One Health University Network, to sustain our effort into the future?
I really think that the future is going to require all sectors coming together. And I think private sectors, again, have not been welcomed in and integrated as much as they should have been with our academic pursuits. And I do think that that's the future. We all know what ignoring the One Health approach and not working together can do to us as societies, as families, as citizens of the earth. And we can pull together, but I do think the private sector, the technology sector, the private pharmaceutical sector absolutely can come together, and then large philanthropy, as well as government funding, not just from the big donor governments, but governments reprioritizing within their own budgets to really put efforts behind this viral detection, discovery, but the collaborative approach.
Thanks, Jonna. So we've heard today about Planetary Health, about One Health. We've heard about some of the exciting work that's already taking place. But in terms of what's needed moving forward, any final calls to action? You just talked about other communities that need to get involved, maybe practically how they can do so.
Absolutely. I mean, if the COVID-19 pandemic isn't a call to action, and if we don't change our behavior and think about the earth and the interconnectedness, we're not protected. Even in our own homes, we try to stay home and protect ourselves. We know we can't isolate ourselves, and we need to change. I really do believe that we have an incredible opportunity to recognize that the drivers for emerging infectious diseases and pandemic threats are the same drivers that are causing the degradation of our planet, and things that we can also recognize, like climate variability, climate change in the long term, and wildfires that I experience here in my California home. All of these things are connected, and they are all about the health of the planet. We are one species on the planet that absolutely dominates, and we're worried about our health. But if we can combine together the momentum of understanding how we need to walk more softly on the earth and use each other's enthusiasm and positivity to infect those sectors that may be a little more suspicious about whether we can make any changes for good, I think that we will have a much healthier future.